Hello guys, and welcome back to my channel Guide to Glory. As I had said, Jagruti is there for us for this video also. And in this video, we are going to discuss about what all things are there in psychiatry clinical postings. Jagruti, now tell us that what was your experience about psychiatry clinical posting?
Psychiatry is one of the most lenient uh, wards it is one of the most lenient wards in our college. There are 2 week postings. In first week posting, the resident would come and they would take lectures. The most important thing that you have to learn during the entire the clinical posting is MSc, that is mental status examination. They are going to teach you that, and for the next week, they take you to NMS, that is National Mental Hospital at Kareli Bagh. It is one of it is a good experience to go there because obviously you don't go by yourself. They take you, they will give you a tour, and it is fun for a minute. Yeah. I have talked to my friends and they used to be like half of the batchmates are like, okay, we are diagnosing ourselves with half of the psychiatric disorders, but okay, okay, that happens too. But you will learn. It is fun. We all know that psychiatry is a good subject. It is a fun subject. If you are interested, you will learn. If you are not interested, then it would be okay still for you. You will get to roam around.
So, guys, if you are not that much interested in psychiatry, so it is a kind of a lenient word. So, even if you don't go that much, or maybe you know, uh, you it would be okay for you. It's not that important, kind of. And at the same time, if you are interested in psychiatry, then you will have a lot of fun and lot of learning. And I still remember, many times we feel that we are going through the same disorders. If we read about depression, we feel like yes, we are depressed. If we learn about psychosis, then we feel that yes, we are also a psychotic patient, like kind of. So it's fun also, and
We align so much with the symptoms. Yeah.
yeah. So kind of we met some of the symptoms, and we feel like yes, we are also suffering from the same. Yeah. So it's kind of fun and also a great fun and great learning to go to that hospital for mental health because generally we don't get an opportunity to go there and learn there. Okay, so now Jagriti, please tell us that what all things a student of a psychiatry ward, if he is not that much interested, then what are the cases or what is the thing that he must know or he should know at the end of the posting?
Okay. So, see, basically, even if you're not interested or you're not regularly attending clinical postings, be it psychiatry or any other, do make sure that you are reading about it from some other source because again, you are going to be an MBS graduate and you have to have some understanding of every subject, like average, but some understanding of every subject. And even if you don't go to the clinical postings, be it because of time constraint, then you can Google it up and you will be able to see videos or else photos of any. So yeah, even if you are missing creators, do make sure that there is some other way you are covering it up. What are the important topics? So psychiatric disorders, we all know very common ones like ADHD, OCD, and depression. Apart from that, there is PTSD, then schizophrenia, histrionic disorders. Then there is dementia, Alzheimer's disease, Parkinson's disease. All of this come under basically psychiatry, right? And the must know it thing is like even if you don't know about any disorder or any pharmacological drug that has to be given in a particular case, do know what is mental status examination. Those few points that are to be covered, you have to know them, the difference between illusion and delusion, hallucinations. You have to know that. You have to know how to assess someone's mood. You have to know what is content, what is thought. All right, you have because these are the differentiating factors in diagnosis of a particular patient. There is also people who have addiction. There are many people. Yeah, even they say and make sure that yeah, be with your friends, but at the same time, be with the guy. Alright, so you will get some knowledge about the history of the patient, like what was the trauma. Uh, I basically, yeah, I don't go along, I don't vibe with my batchmates much. So, yeah, I was interacting with the guide during the time, and she told me 2 to 3 stories. Yeah, that was marriage after marriage, there was trauma, or because they were not doing good in life. So, they felt depressed, and then they came over here. And yeah, what do you say? एम और जो भी होता है मतलब एक मेन होंगे who will sit in the office, who will supervise everything, and then there is actual residents who take tours and interact with the patients. Caretaker type, but also a doctor type. So yeah, you have to interact with them. Also, there are patients, yeah, this addiction patients. You will see withdrawal symptoms. That guy will tell you okay, these are the withdrawal symptoms. It has a very good correlation with the pharmacology subject. The guy told that sometimes some patients are running on the streets. Even we might have experienced like someone is a business tycoon, and because he lost all the money and everything, so he became very depressed. He got traumatized. So yeah, and then he was screaming on the road or something like that. So they even bring from that place. Even the car, you will even learn about the hospital. Like the walls were first constructed lower, but because those patients used to run away, they heightened the walls to make the yeah to make it more protective. Then there are secularized rooms which are not in use now for obvious reasons. But yeah, it was open. It was showed कि हाँ पूरे room में there was गद्दे गद्दे. They showed कि गद्दे इसलिए लगाए क्योंकि when the patients go mad, they bang their heads on the wall and
Oh.
yeah, keep it up bleeding होता रहता उतना ज़्यादा. And even those patients who are mentally ill, they are kind of good. I shouldn't say this, but half of the people who are kind of caring them, they are not going to harm you. All right, yeah, like some drug addict might, but who has already been kept in that locker room, but who are roaming around here and there, they are not going to harm you. There was a lady who was from Kerala, something. She introduced us. She had this big smile. She was on therapy, something, and yeah, she was doing well. Then there was another lady who came from some other country, but there are something prisoners or something like that. She said कि आ गए हैं, they are immigrants, इनको accept नहीं किया, and फिर वो यहाँ पे आ गए थे ऐसा कुछ. So yeah, there are stories. We learn a lot of stories over there. And
Yes.
तुमको normally after हाँ this is the only one day. Other days तुमको वहाँ पे जाके 1 घंटा history लेना है. And the other are they ma'am is going to take a lecture based on what history you have taken. Also bipolar disorder भी होता है. And yeah, और जो patients say if you are gonna ask one thing ना, they will tell you. Their relative will tell you कि हाँ ये था ऐसा ऐसा था. And you will also learn about the society, like how they stigmatize this kind of things and how difficult it is for the patients. Like, yeah, EdCom is one thing. We may attend it, we may not attend it, but when you talk to patients' relatives and the patients themselves, you realize how you should interact with a particular patient. Yes, you have to keep in mind empathy while interacting with them. So yeah, that practical point of view you will understand.
Yeah, so she has told a very, very important and a lot of points. So to to summarize, but just before I summarize, I hope this video is not seen by your batchmates because you told that you kind of don't mix up that much with your batchmates. But
But then they know what.
yeah, so hope that at least they don't get offended. So coming back to summarizing,
Yeah.
so she told very important points that one thing is that there are some basics that you need to know. As she said, that even if you don't know any disorders, at least know the mental status examination and the history taking part of psychiatry. Those are the things that one must know. Another important point is that if you are from such a college where you don't tend to see that many cases, not just in psychiatry, for any clinical posting for that matter. Then in this information age, there are many sources to get knowledge. So by looking at images from Google or maybe seeing videos from YouTube, but you need to learn certain basic stuffs that an MBBS student must know. So if you wish to learn, their sources are unlimited and the choices are plenty. And yeah, and she also told very important point that from this talk we can also get to know that each and every subject, including psychiatry, is also very clinical, and you tend to see a lot of cases if you are interested and if you are ready to learn. So coming back to this, so Jagruti, please tell us that what is all asked in the exam of psychiatry and how to prepare for the same.
So psychiatry exam, they are going to conduct in the evening. They will call you 1 hour before the actual scheduled time. This has not happened just with us, but other batches too. They will
Yeah.
call you, and along with your seniors, they are going to take. And yeah, it's going to be pretty easy though. You don't have to panic or anything. If you have notes, prepared notes from like any institution, you can follow it. But even if not, do make sure that you go through the MSc and those points. You must know those points. All right. Or and after that, you can choose any disorder of your type. Prepare at least 1 or 2 disorders properly so that when resident asks you okay, which topics you have prepared, you can tell them and they will ask you questions from that. They are good, and even the best part about psychiatry department is the resident gives you feedback on your answers.
Oh,
Alright, कि हाँ इसको ऐसे नहीं बोलना है, and she told me कि these are the few points that you have to take in consideration while answering an answer. Yeah, while answering to a question basically. So she said, okay, right now I'm here and as such it is good, but still, if you take this course, you are going to get extra grades. So make sure that you inculcate those points. And it is suggested that whenever you are given a feedback, you should try to inculcate it right there and then. All right. So if you are incorporating it, even the interviewer or any person is asking you a question, they know that yeah, this person is trying to learn. Apart from that, it is easy. Okay, you will crack it. It's nothing very hard or you have to stress for it. If you have paid enough attention, if your pharmacological subject is good, and if you know what is MSc and particular definitions, or if your English vocabulary is good, then yes, you will be able to answer these questions and your viva of psychiatry will be good.
yeah. So she told a very important point that uh, the the teachers there are good. So even if you don't know something, they will teach you. So at least you will have a learning experience. And the things are quite easy. Like even if you have done, as she told, that history or mental status examination or basic pharmacology, then also you will be able to easily give that viva. So there is nothing sort of panic stuff. But yeah, a lot of learning if you wish to. So that's all for this video. Uh, yeah, one more point before that. Which source to read if someone wishes to go little bit in detail about psychiatry?
Neeraj Ahuja has written a book on psychiatry, short book basically for undergraduate level. It is followed even by some few residents. So yeah, you can use
Okay,
anytime you can use it.
okay. So that was it. So that's all from this video. Uh, Thank you, Jagruti, for being with us. We had a great learning experience with you. So that's it for this video, guys. Subscribe to my channel and stay tuned. And I see you guys in the next video. This is me, Yash Gandhi, signing off.